Welcome everybody to the last session of the first day. For those of you who don't know me, I'm Natalia Rachmanina. I'm a pediatrician working in Washington, D.C. I also do a lot of global work as a senior technical advisor for Elizabeth Glazier Pediatric AIDS Foundation. And it is my absolute pleasure to welcome you to this last session of the day, which will be debate, and we will ask for your very strong participation. Let me start with a few housekeeping items. We welcome all attendees, including those online. And attendees online, if you have any points along the debate you want to share or ask questions, please feel free, so we will be looking at your messages. Please make sure your phone's on a silent mode. I know it's difficult to get from the nice weather outside, but we really appreciate you all coming back to the session. And let me introduce you what the debate is like if you have never attended one, and what we are going to do, and who will be our fantastic presenters today. So the debate will start with a proposition that you are seeing on the screen. The proposition reads: adolescents of all ages should be able to independently consent to sexual and reproductive health services and related research. You will be given an opportunity to vote in the beginning of the debate through the METI application on the phone. We are going to move there shortly after introduce our speakers, and you will be able to vote your opinion, and there will be three options. Yes, I support that statement. No, I don't support this statement. And there will be an option, I'm not sure which direction to go. So after your vote, we are going to see the results of your vote on the screen. So the audience, all of you, will know how you are thinking on that subject. After that, we are going to invite our fantastic debaters today. And the first debater, my biggest pleasure, who accepted the challenge, is Wole Ameyan. Wole is a physician and HIV specialist who has a wider range of experiences. He's a medical doctor, also has a master's degree in international public health. He worked in multiple global settings. Wole, keep your seat, because I'm going to introduce the whole team first. and he also leads the work at WHO right now in adolescent work. So many of you have seen some fantastic tools coming out of the World Health Organization, particularly in recent years, led by Wole. So we welcome Wole to defend pro position. Now, a very, very brave and a very strong-charactered woman accepted against position, contra, and this is Dr. Eleanor Namusoke-Magongo. She represents Minister of Health of Uganda. Dr. Magongo, Dr. Eleanor, is an excellent pediatrician. I have been working closely with her for many years, and I can testify that I have not seen a stronger advocate for pediatric adolescent HIV, and incredible work on decentralization that she has done, and a lot of work at the national level. But she's also a founder of the Pediatric and Adolescent HIV Learning Collaborative of Africa, and she's also a founder of the IFAZA, or International Pediatric HIV/AIDS Symposium of Africa, that's going to take place in December in Harare, Zimbabwe. So welcome, Eleanor. So we will start by first the grown-up, kind of on the elder side people presenting their position, pro and con, and then we will move on to immediately following the debate points to the young community representatives. And it is my biggest pleasure to represent to you them. First is Carol Mutale. Carol? So So Carol is an incredible young woman who works with Ministry of Health, National AIDS Council, UNICEF, and CIDRS here in Zambia. She is a peer educator who, despite her young age, holds many certifications, also including Forum Theater, Basics of Psychological Counseling, Community-Based Distributor as well. So welcome, Carol, and she will be supporting pro-Wole position. And our last but not least debater who will be supporting Dr. Eleanor in con position to that proposition you are seeing on your screen will be Fanuel Sakuya Mubuyaeta. Fanuel. Fanuel is also a peer educator, a very accomplished young man who has a wonderful opportunity to deliver a lot of peer education in a place where he works, which is Tati Beauty Studio, and we do know of incredible advocacy work he has done as well. Now, after all the debaters have taken stage without any further interruption by me, we are going to turn to the audience, and we are going to look at your comments and questions and anything that you will have to say on the subject, just even the comments and your opinions, answering to the points raised by debaters. At the end, we are going to move to, again, voting in the same mechanism that we started with, and at that voting, the person who changes most of the votes wins. So it is not the majority, because we kind of anticipate what this room majority will be at the baseline, though I do want you to really think about this in a real-world scenario. It's a great proposition, but is it really working? Could it work? Should it work? That's what your voice will be about. And at the end, the debater team that changes the most voices and the most opinions will be the winner team. So these are the rules of the debate. I think we can move on the voting right now, right? So please get us to the vote. Show us how to do it. Please take your cell phones out. So you will need to go to menti.com. You either scan this QR code, or for those of you where it is far, you need to go to menti.com, and then you need to enter the code there. And the code, for those of you who can't see it, 8393. 8832. I repeat, menti.com, and you will see the code, area to enter the code, 83938832. I see already 3 votes. Vote starts coming over. Are they voting? I don't think so. I think you already have your position. Okay, and you will see the numbers grow. We only have 12 voices right now. I will repeat. It's called menti, menti.com, and the code that you need to enter reads 83938832. 3 options. You choose the one that you believe is correct. Give it a minute or so. I think if you don't have cell phone, if anyone is on laptop, you can also do it from laptop, but cell phones should work. Okay, our number of voices is growing, so we have 56. Please keep voting because there are many more of you in the room. This is the only time you can really be heard in this room, right? During the whole meeting. No, please vote. We want to hear from you. And people online have the same opportunity to cast the vote. So people online, I see in the slide, I can hear you back, but please vote as well. The Wi-Fi might be a little bit slow, so we give it a little extra time. We have time, we are good on time, so I'll give it another minute or so, please. I think because all of us went online directly, we are slowing down the traffic probably. Okay, good. Okay, menti.com, 83938832. Give it one more minute, Karin. One more minute, since it's a bit slow. You have any numbers? Huh? 90 votes? Okay. Let's cross the 100 and then we stop. Okay, we are up to 90 votes, I'm told, and we are going to wait to cross the 100 line before we look at the results. Getting there? One more. Okay, we have over 100 people. We are going to show you the baseline results of the vote in the room. So not surprisingly, at the HIV and adolescent meeting, we are seeing a very big proportion, 63% of the people agree, but a pretty sizable proportion, 28% of the audience disagrees, and we have 11% who are undecided. So with that, I'm turning the table to you, Wole, please.
Right. Thank you so much, Natella. And I have to say, it is a privilege, and I'm so delighted to be able to share this space with you and to interact and to speak on what clearly is a very important topic. Now, as one of the ground rules for this meeting, I was actually told that I shouldn't patronize the audience. So I'm going to try to to refrain from that. But actually, I look, seriously over the room. I look through, to the backside there and everyone. I have to say that this has to be the most beautiful audience that I've ever seen. Absolutely, and that's true. So in taking up this assignment, I had to go between, either being lighthearted and making it fun, or being a bit more serious. It wasn't an easy choice for me, but, everything is fun until it gets, a bit serious. And I think this is one of those topics that, even though it is fun, it can actually get, quite serious. And I'm going to show you just a few data flashpoints that show quite a sobering concern about the issue of consent and access to sexual and reproductive health services, but also the shared responsibilities that we have, on this. Every day, and this was spoken about earlier today, 20,000 girls under the age of 18, they give birth. Now that is just shocking. Going beyond that, we have a third of young women in developing countries marrying before the age of 18. And in terms of deaths and mortality, we actually have complications from pregnancy being the second most common cause of death in young women. I think this sort of data flashpoints show how important sexual and reproductive health services are and the need for to be able to have adolescents independently consent for these services. Now, it boils down to if there are benefits to consenting or not. If there are no benefits, I think we can say, okay, well and good. But there are actually documented, scientifically relevant, and very clear evidence on the benefits of sexual and reproductive health for adolescents. One of the things we hear about is risk compensation. If young people and adolescents have free access to sexual and reproductive health, it might be that they probably have more sex. It might be that they probably have more partners. But that is actually the contrary of what the evidence shows. Actually, we have seen, and this is clear from multiple evidence and research, that following access to sexual and reproductive health, there is actually evidence that adolescents have later sexual debut, so they start having sex even later, there is decreased number of partners and reduced sexual risk-taking. They have more accurate information, of course, and better health and well-being, and certainly challenging gender norms, which we know is such a big problem. These services help to equate and to challenge those toxic gender norms. Now, can they consent? Do they have the capacity to consent? I think we look at this in a bit of the wrong light. It's not really about whether they can consent. It's more about whether it is a right or not. And there are multiple treaties around the world that show that adolescents actually have the right to life, they have the right to this information, they have the right to give independent consent for reproductive health services if their capacities for understanding have sufficiently evolved. So I would crave your indulgence, ladies and gentlemen, to move this away from an issue of capacity to that of rights. And when you have human rights, this being one of them, we have absolutely no choice but to put the gates open and allow adolescents to independently consent. Now, I work for WHO, and proudly so, and we have numerous evidence-based recommendations that support the proposition that I know you all actually support. Countries are actually encouraged to examine their consent policies and consider revising them to reduce these age-related barriers so that adolescents can benefit from these services. Now, it's all about fear or fact. So as you vote, I urge you to look whether you're actually voting out of fear or actually following what the fact is. The fact, one, would be that this would lead to unbridled sex and promiscuity. The fact, of course, is that adolescents already have sex, indeed, loads of it. There is data to prove that, and we need to be able to move away from this fear of sex and promiscuity to actually see that providing these services actually lead to better outcome. Abstinence, of course, is another fear. We say, okay, it's much better. Let's move away from leaving the gates open to abstinence. We know, certainly, that abstinence-only programs do not work. Actually, the intentions vis-a-vis the practicality of abstinence is what we know matters. Third, this would lead to confidential care with no parental control or supervision. I think we cannot dismiss that fear. And we heard that come up today in the meeting, earlier in the opening. The fear has to be acknowledged. But actually, it's a choice between having this confidential care or having what I would call secretive care, which we know comes with shame and stigma and all of the humiliation that we know is not right. Adolescents are young children and they lack experience. Of course, they are not, and they have the capacity and the ability to consent. So I'm going to round up now by saying, my colleague Eleanor is someone I know really well. I am sure that she's not going to come here and do something opposite, because I know what she believes in. She believes that adolescents have the right, to independently consent, and it's not really about winning this debate. It is about winning together and actually being on the right side of history. Thank you.
Well delivered, Wole. Dr. Eleanor?
Thank you very much, and thank you very much, Wole, for giving me a good point to start. So I know that I'm starting from a very disadvantaged point, Fanel and I, but I hope that by the time I go through this debate, you will be able to change to the other side. And before I start, it's very important that we understand what this topic is all about. So it says adolescents of all ages should be able to independently consent to sexual and reproductive health services and research. So we are saying that a 10-year-old should walk into this facility, find a healthcare provider who is not well trained in the adolescent health services, and they tell them, oh, hello, are you sexually active? And this 10-year-old looks and says, what does it mean to be sexually active? So that's what Wole is telling us. Next slide, please. Are they moving the slides for me? Oh.
Next slide.
This. Okay.
I can do it.
Yes. So this is highly scandalous, and you don't need to append your name to such a scandal. So I want to appeal to you to vote no. So let's go to the definitions of sexual and reproductive health. I looked at the WHO definitions, but I chose the Mary Stopes definition because I thought it was simple and easy to understand. So we are saying, and Wole is telling us, that this 10-year-old should be free to decide who to have sex with. They should also be free to think about unplanned pregnancies. Among all the things they're trying to learn in school, in Africa we learn about the Alps in Switzerland, the Canadian prairies, and in addition to that, you want to overload them with this information because the motion says all adolescents. For the many years I've been in the HIV program, most times we talk about sexual and reproductive health. It's about contraceptives, you saw Wole's slide, safe abortion, but is that all that there is to sexual and reproductive health? So this is my opponent. And the youth in this room with that jacket and the poster, they would say, man, this is a bad guy, meaning that he's actually cool. And what is this cool guy telling us? He is not telling you the hidden meaning behind the agenda in this motion. Wole is telling us that our young adolescents, because the motion says all, that do it and don't tell your parents or guardians about it. He's also telling us that when someone does it to you, and you know what I'm talking about, silently handle it, and then we get surprised that there are a lot of mental health issues among adolescents. This is a story about a 10-year-old, and this story in the US has raised a lot of debate about a 10-year-old who was raped and had to undergo an abortion. And when you read the report, it says this was a 10-year-old child. So just because we as medical people, we choose to categorize and say 10 to 19 as adolescents, and we begin to assume that they are old enough to make decisions on their own, doesn't take away the fact that a 10-year-old is still a child. This child was raped twice, so someone did it to them, and they were silent the first time, they were silent the second time, because we are saying, be independent. Don't go to your parent, don't go to your guardian. And before they realized it, she was 6.5 weeks, and a 10-year-old had to go and undergo an abortion. Is this how liberal we want to be with sexual and reproductive health? Say no to this scandal, please, and vote no. Now, we also have some statistics. As of 2019, yes, we know that adolescents 15 to 19-year-old, about 21 million pregnancies occurred. Most of these are unintended. They lead to unwanted abortions. But let us also remember that there are 1.2 billion adolescents. And these 21 million and the statistics that Wole has presented is about 1.7% of all the adolescents. So while we do not undermine the challenge, can we also focus on the positive messages for the biggest majority of the adolescents? And when you read the WHO website, where Wole works, by the way, it says that the causes of early pregnancy that he well explained on his slide is low education level, economic status, employment issues, sexual abuse, ineffective policies, low access to contraceptives. Parents do not know, are not talking to their children about sex. And my question is, when you look at the sexual and reproductive health package, is it really addressing the issues? Are we focusing our interventions on the real problems? I would say no. It's very important. It's very, very important that when we talk about sexual and reproductive health, we must hit the right target. And my opponent, Wole, is not new to hitting targets. So why is he doing the opposite in this debate? When you read the World Health Organization, when I read this statement from Wole, because that's where he works, I felt very calm because it is talking about exactly what we need. Age appropriate, for God's sake, comprehensive sexuality education, develop skills. It's not about condoms, family planning all the time. The young people in this room will tell you that the employment issue is a big challenge. It causes vulnerability that leads to commercial sex work. So why don't we address the right things? A safe and a supportive environment, and we are saying that we should let them be independent. As I wind up, we were told by the great poet this morning that kids have outgrown the box. They need new interventions, and they need our support. So I'm here to tell you that Wole does not mean what he says. Because this paper, where Wole is an author, says that psychosocial support interventions are important. So why is Wole lying to us that children should be independent in this decision making? So do not append your name to this scandal. Please vote no. And as I end, we know that there are interventions where parents have been involved. Because of time, I won't explain. These have shown that when parents are involved, sexual and reproductive health issues are better addressed. So can we desexualize sexual and reproductive health and address the real issues? Thank you very much. Do not append your name to the scandal. Please vote no.
The power of women. We will keep going non-stop, and now cede the stage to Carol, who will support Wole after the challenge by Dr. Eleanor.
Good afternoon, everyone. Thank you so much for the opportunity given. So I will start to say freedom is the right of people to assemble, organize, and freely have their discussion and decision in a debate. So I urge you, everyone, that have that freedom and not be forced to vote for what you want to. All right. My name is Carol Mtale, a PA educator from the Pediatric Center of Excellency, University Teaching Hospital. Okay. So I'm standing from the proposing side with a motion that states, should adolescent be granted independent consent to access sexual reproductive health services and other related research? I strongly agree. Let me articulate more on the keywords of this motion, adolescent. So according to World Health Organization, it states an adolescent, this is a person from the age of 10 to 19, a transition from childhood to adulthood. Let me articulate more also on consent, what this consent is. This is a form or an agreement of a person that they agree towards their decision and actions that they make. Sexual reproductive health, this is the information that anyone can get so that they get their best well-being in their healthy behaviors. Allow me to express myself to say, I strongly agree to this motion. Yes, adolescents should be given or granted all the consent that they should need. I'm sure we have adolescents in here and we know our experiences that we pass through. Many other times in the African setup, you find that an adolescent can go and explain to his or her mother about what is happening to their bodies, and they do not take that as a keyword for them or for them to accept it. Members of the symposium, let me articulate more that it is important for this independent consent to be given to the adolescent. Why? Because adolescents should have an independent consent without need of parental consent. I work from a community based, and you find that adolescents, when they want this consent, they feel shy to go and talk to their parents. Even in the African setup, most parents, they do not have this information and they do not know on how to go about it. It's just that through this podium or through this symposium, we find that most of us, we have this information, but in the African background, we find parents do not have this information, yet the adolescents go out and want to access these services by their own. Adolescents have the right to make decisions about their bodies and healthy care. He talked about having the right to healthy. So it is their rights that they should have this. It's not only that they will be encouraged to have sex, no, but also abstinence. Imagine an adolescent comes to a clinic or a friendly space where you give them information on the importance of abstaining and also on the dangerous part of them engaging into sex, which will lead them to risk behaviors. And they'll have their decision to make and see how best that they can go about it. It is essential to provide accurate and comprehensive information to adolescents to help them make informed decisions. Members of the House, we find that there's a high rate of sexual infection or HIV infection. Let me just go to according to the Zambia National Adolescent Health Strategy, on page 27, you can look at that, where it states to say there's a higher rate of infection, of HIV infection with the adolescents. How is it? Because they're not having this information, they're not given this consent for them to consent on their own, for them to have for them to have healthy decisions and also to make healthy plans. Members of the House, also according to the National Library of Medicine, it talks about the unsafe abortion. And this also it's stating from the output of the adolescents. You find that most of the adolescents, they are engaging into sex with consent or without consent. This is happening. Am I audible enough to the adolescent with what I'm saying? Without the consent, adolescents are engaging themselves into sex. So the key word is to give them the information, not only that we are advising them, no, but we're giving them information so that they can do the right thing and also they can make healthy decisions for our nation to be better. Members of the House, allow me to talk about the complications of this. So in conclusion, if we give this consent to them, we are going to reduce the limit of access to information on health, and also we are not going to have delayment in treatment, for we will find that there will be mortality rate with the maternal to the adolescent, and also there will be suicidal thoughts if their parents are not advising them or also supporting them for them to access this information. I rest my case.
Thank you, Carol. And now I invite Fanuel to support Eleanor.
Good afternoon, everyone. Sorry, is it on? Good afternoon, everyone. First things first, I'm going to tell you a little Latin phrase that I really love to recite a lot. It says, "Si vince pacem para bellum." Translated in English, it says, if you want peace, prepare for war. Our opposition hasn't prepared for none of these either. So right now, I just want to talk about something that really happened to me as I was growing up when I was an adolescent. First time I found out my HIV status and how I handled it. I was roughly about 10 to 11 when I just found out I had HIV. And I also found out it was a sexually transmitted disease. But the first thing I asked myself is, what is sex? I didn't understand what it was. They gave me the information, and afterwards, I wouldn't lie to you, I experimented as much as I could. Why? I was given the consent to have such information at a very young age. But now, me as a guy, that was just me choosing what I wanted. I want you to think of this. You're a parent, your 10-year-old child comes to you, says he or she, most likely she, just had sex with a man who's 32 years old simply because she went to a hospital and was given consent to condoms, contraceptives, and she also gave consent to the man to sleep with her. How would you feel as a parent? You would think twice and ask, why is a medical facility giving my child such information? Why are they telling them to say, oh, you know what, if you're going to have sex, might as well use a condom. Or if you don't want to get pregnant, might as well use a contraceptive. That does not work like that. What we're trying to do here with Dr. Magongo here is to remind you guys that adolescents are not adults. The age group for adolescents is from 10 to 19. And if we're to break down adolescents in categories, 10 to roughly 14 is early adolescent. 15 to 17 is mid-adolescent. Late adolescent is the rest up there. So now imagine if I gave a child who's 10 years old enough consent to say, okay, here's contraceptives, here's condoms, here's all the knowledge you need to know about sex. What's the first thing they're going to do? They're not going to first go ask about their parents. They're not going to ask for permission. They're just going to go straight and try to experiment and find out what goes on. Because why? We don't have to ask our parents. We go straight onto it. And this is 2023. Kids already don't care about parental consent. If we are giving them all that consent for their own, how much promiscuity have we seen? In the industry that we live in, sex sells. Already the music, the movies that we watch are telling our kids, you know what, for us to live a better life, let's experiment. Let's go have sex, let's go try drugs, let's go kill people. All that is telling our children to say, let's just go straight ahead. Let's not ask our parents, what are our parents here for? No, we don't want anything from our parents. We just go straight and do everything. But when I go back to my experience, I asked my mom for help. She gave me the consent, yes, but I still needed her help to understand everything I was going through. It was a tough time for me. I didn't understand anything. First, I thought I was going to die. At some point, I just wanted to self-destruct and help everyone else just by giving them the virus, giving them the virus. But at some point, my mom came to me and said, you know what? This is not how it's going to work out. Let me teach you on why they're telling you this so that when you get older, you're not going to make the same mistakes other people make. So the consent I was given wasn't necessary at that point. The first thing I would have loved them to do was first educate my mom. Educate my parents, which now takes me back to an African proverb which says, to raise a child, you need a village. You don't go straight to the child. You start with everyone in the community. Give them the information that they need. Tell them, okay, this is where we're heading. We've seen what's going on in our community. How are we going to stop this? Teenage pregnancies on a high. Adolescents getting the virus on a high. People abusing contraceptives on a high. How are we going to stop that? No, let's not give them the consent. Let's first talk to you, the adults, so you can ease them way, slow by slow, so they can come in and talk about something that a child won't understand but will slowly grasp as they grow. We're not trying to say kids or adolescents shouldn't have consent to sexual health. I really want you to have the consent, yes, but I want it first to start from your house. Before you come to a hospital, just to get information that you've never heard, never thought of, or have never even imagined, for you to now just take it out in context and say, you know what, I'm just going to go straight ahead. The doctor told me, I won't get pregnant if I take a contraceptive. Oh, I won't get the virus if I take PEP or PrEP. Oh, no, you know what? I'm just going to go ahead and do whatever I want. My mom does not need to know. My dad does not need to know. No one has to know because I choose what I want. So all you know, what I'm trying to say is adolescents can get some sort of consent, but not all adolescents. The early age of adolescents shouldn't get that because they won't understand. Imagine going to schools and telling children on how safe sex works and all that. We're not saying don't tell them, but in a way that it won't really ruin their mental for them to start thinking, oh no, let me go experiment, let me choose what I want, let me do everything that I want. I work in a beauty studio. All the stories I hear from the young girls that come in, I go to a barber shop, all the stories I hear from the young men that come in break my heart simply because they've recently got some sort of consent to sexual health information. They start telling their friends, oh, you know what, you can sleep with that girl. The contraceptives, you can sleep with that guy. The condoms, which, to be honest, they still never use. Because in Zambia we've got this one saying, ungadie sweet narapa. Ni boza hiyo. So in conclusion, what I'm trying to say is, all adolescents shouldn't get consent, at least not those in the early stages. Let's at least ease them off from the community, first starting with their house and everyone else, and then as they grow, they can officially just walk in and say, I have some sort of knowledge and I'd like to get more to protect myself, people around me, and my family. Thank you.
Well, first of all, big round of applause for our debaters. And second, the disclosure that I really want everyone in the room to understand. The fun part of debate is to raise the legitimate concerns and discussion, and the debaters don't have to particularly present their own point of view. So I just want to make this disclaimer. I've debated on the completely opposite side before, so just keep it in mind when you attack them in the hall with your points after the debate. So at that point, what we will do, we will open the room for your discussion. Make your points, ask questions, address debaters, challenge their points if you want. At the end of the discussion, I'm going to take a few minutes and give each of the debater the chance to do the last rebuttal points for about 1.5 minutes. Once they've finished their rebuttal, it's your time to vote. So we will start with questions. I don't have any particular order. I will just go by how room is breaking down. This one first, then we'll go 2 here, and then we'll go 1 there. So let's start with the left, or whichever microphone is closer, maybe, or whichever microphone works. Okay, let's start here. That's number 4 here, please. 2 here and 1 there, and then we will take second round.
Hello, can you hear me? So I wanted to start with the notion of all adolescents having this information, having this consent, right? And you are saying that it would help with the stigma around it, for them to understand it better, for them to get help quicker and all of that. But I don't think that really, I don't think that's the right understanding, because even at the age of 30 for females in some countries, or at the age of 20 or whatever, you still get stigma from the same nurses or health workers, as long as you don't have a ring, as long as you're not married, that you're getting contraceptives or that you're getting anything associated with sexual activities and stuff like that. Secondly, the point that he brought up, that we need to educate the parents and the society before the child, I think is of great importance, because when I was younger, let me just personalize it. Yeah. When I was younger, the first introduction to understanding what is wrong and right comes from your parents, in different scenarios, but it comes from your parents and your society. So if I go to any place where I can get this information from, and they're telling me it's okay, it's all right, and my parents don't know anything about it, and they never will, because of this consent I have in my hands, this power I have at the age of 10, 12, or whatever, you don't know how I'm going to use that to my advantage. Everyone in this, not everyone, but most people researched what sex is at some odd age in their lives. And guidance was then given by an elder person, which was not necessarily a health worker. Someone close, maybe a guardian, maybe an aunt, an uncle, or a parent. And then from there you learned what is right, what is wrong, what should be waited for, what should be done later. And then also the age of consent in the world, I don't think it's the same in all countries, is it? Even for sex itself. Some countries 16, it's not rape, you can give consent at 16. Some countries 13. Some are still even debating on what age can give consent. So that we can't say all adolescents. We have to then go and deal with that issue of what age is actually able to consent to sex itself. And then we also have...
Please let us give other chance to, so if you wrap up, kind of.
Okay. And then the issue of parents, I feel like parents have already been limited in our time. Like we have limitations of they can't beat their kids, which is good, but for some, not so much. Now you want to put a limitation on them not knowing about what information is being fed to their kids. Yet they have consent over your education, your dressing, your everything, but not you knowing about sex. That's a bit unfair on the parent themselves, you know. And then lastly, I'm almost done. Lastly, children can be taught about sex. We're not saying don't teach kids about sex. For me personally, we went to a high school where they taught us about sex, but honestly, they traumatized us at the right age because they taught us more about STDs and STIs. So we were scared about sex until you're older. Then you find out, okay, now I can get more information and see how I'll then. But at that age, you know, this I stay away from. It's there, but I stay away from. So I think that's just
Thank
that's
you.
it.
Thank you. Let's be mindful of each other. We have only around 8 minutes left. I do ask people, as you make comments, it's a very hot topic. We anticipate a lot of discussion, but please be mindful of some other people who also want to speak. The microphone there is already in place, and then we just take 2 more. We are running out of time, so please be mindful of your other attendees. So 1 there, and we go back here to 2 original hands.
Thank you. I would want to really acknowledge that Eleanor has had very persuasive argument. However, I'll go with Wole. There's a saying in my community that goes like, even fools get old. So it is not necessarily true that because you got old and became a parent, therefore you're qualified to define what is good for a young person. So remember, some of the people that we are expecting the young people to go for information are those very parents who do not have the knowledge. So you can imagine, instead of investing on the young person who is before you, you still have to go and now educate someone so that they can be educated enough to come back and tell the adolescent who has already Googled what they need to know about PrEP. And then you're trying to explain PrEP to a parent to give a consent on something that they won't even understand. Those fools who get old and become parents, let them be. And then empower the adolescent, give them the power, and let them make that decision.
Thank you,
Last but
Joe.
not least, is to say, sometimes we keep saying, yes, but, yes, but. Why do we say yes, but? That now let's start saying, if they are 10 to 14, yes. If they are 16, that is too much yes, but. Let's just go on, Wole. Give the information to the adolescent girls and young women. Give it to the boys.
Thank you. We will take the original hand number 3. I'm looking at the time, and then we'll see if we have time. There were 2 original hands there, and I want to stick to this promise. So please, the yellow jacket number 3. Yes.
My name is Cherish Siwode, and I'm from the Zambian Hub. And I'm with Team Eleanor, and my points are that it is in this room where we were told by Professor Baker that adolescents mature at different levels. So I think not all adolescents possess the maturity to make such decisions. They might underestimate the risks of the decisions they're making, or they might make those decisions based on peer pressure, because this is a group that is facing a lot of peer pressure. Secondly, my point is that adolescents from 10 to 19 still need emotional support. And imagine a 10-year-old undergoing an abortion without telling their parents. They need home care, they need support from their guardians and parents. So I strongly disagree with the motion, and I encourage all of you to vote no, please. Thank you.
Okay, there was a first hand next to you, somewhere very close to. Okay, if I'm missing up the people, I think this gentleman there was next. Yes, and then we have time for number 4, and then we'll probably have to wrap up. Please try to keep time when addressing.
Good afternoon once again. So my name is Band Isaac. So what I would say, for me, I'll go with yes with emotion, because according here in Zambia, I don't know how based into other countries. When you look at, to men adolescents, who have contracted many diseases, and this it is, and those which have gone long are those in rural areas, which are, which they don't have access to these health facilities, and also some of the information. When you look at many of the young people, who have gotten, let's say, who are being pregnant at a very tender age, are those in rural areas than those here in urban areas, which I believe the main cause is because they lack access to information and also these health facilities. So for me, I would say yes to the motion. Thank you so much.
Wonderful split of the audience, which I think is really showing the debate topic is important. And the last question, we will be taking number 4, and then we will come back to all our debaters for their rebuttal points on the debate. Number 4, please.
All right, thank you. My name is Salma Iyambo, and I'm from Namibia. Thank you so much for the insightful discussion, and thank you for bringing to light that these are not their personal opinions. One thing that stood out within the whole thing as those that mention age appropriate, and this is something that most of us are not aware when we speak of comprehensive sexuality education. However, I am going to go to Fano when he speaks of his experience, and he was informed of this and actually decided to try it out. I want us to understand that young people have grown out of the box. The environment that you were in 5 years ago versus the environment where we are right now is not the same. So we need to be considerate of that, and don't let young people suffer because of what you have gone through or what you have experimented. Why must we walk in your shoes and it's never going to be the same? Circumstances are not the same. Access to information is not the same. Hence, give young people an opportunity rather than looking at ourselves. Because if we have observed, the reason why we are sitting in this workshop, why we have alarming statistics, is because our leaders are thinking like Fanwo. They wanted to experiment when they got the little information because the environment was different. However, we have grown out of the box. So when you make decisions, when you think of scenarios, think of that, and that's why you need young people at the table to take the seat to give you insight when you make decisions. Thank you.
Thank you. So now has come the time for the debaters to rebut on all the points that they heard from the opponents and to rebut to the points that you so thoughtfully raised in the audience. And thank you for your participation. There was very modest raise of hands in the beginning, and it grew to a very strong voice of the audience. So thank you for that. So we will go ahead back in the same order as we started, starting with Wole. And H1, whatever you like. And they will be doing last rebuttal points. Try to stay within 2 minutes.
Right. So I will try to stay within 2 minutes. Thank you so much to everyone who's contributed. I feel like, most of the points I would like to raise have been raised already by, esteemed colleagues who have actually supported the motion. But just a couple of things. The first is that when we say all adolescents, it's like saying, all people and all adults as well. Adults that cannot or do not have the capacity, and we have, those of them as well who cannot actually, go ahead to independently work or access services. Of course, they too wouldn't, be able to access services. The point is that all adolescents who have the capacity and have that, iteration to be able to get services should be able to get them as they need them. Now, the second thing is about, this, notion about sidelining of parents. And I think I sort of mentioned it, when I spoke about either confidential care or secretive care. We have been, service providers where we have seen, adolescents, very young adolescents, come into the service with their parents. We've also seen adolescents who come, with peers and without parents, right? I think the point here, and this is key to all of you when you want to vote, when an adolescent decides to come into a facility with a parent, there is usually a very good reason for that, right? There is a good reason in terms of the dynamics in the house and in the family, and so on and so forth. Now, the contrary is the case. When an adolescent decides not to come with a parent to seek sexual and reproductive health services, there's also usually a very good reason for that. And I'm sure you all would agree to that. Thank you.
I hear you. Parents don't have knowledge. We should let the fools who are old remain fools. So with that statement, I would like to advise Wole which guidelines he needs to throw away when he goes back. 1, throw away the client-centered care. Throw away the psychosocial guidelines. Throw away the patient literacy. And for the many of us here who are doing programs where we are doing literacy for caregivers, literacy for parents, we should throw them away. So if you don't want to throw away these guidelines, please vote no. Pregnancy in rural areas, I hear you. What is the real issue? They are vulnerable. We all know the statistics that when you maintain adolescents in school, things change. They're not going to engage in sex early. They are not going to have unprotected sex. They are better at bargaining for what they want. They are empowered. So, pregnancy in rural areas, address the vulnerabilities. Put them in school. Create education programs. Empower them. Provide employment. Why would a girl sleep with a man because they're going to get an iPhone? If they can, iPhone 15, I'm told. If they can get it, if they can buy it, why would you want to sleep with a man to get iPhone 15? So empower. Grown out of the box. I hear you. I want to say that now, as you grow out of the box, now is the time when you need parental guidance more than ever. Because every time you go to WhatsApp, when you go to YouTube, the first thing that is going to pop up before you download the document you want is a naked woman. So without parental guidance to contextualize that, we are throwing away our generation. And lastly, biology, growth development, mental growth has never changed with digitalization, urbanization, and migration. Biology doesn't change. So you are first a parent, and then a medical worker, a community health worker, a peer supporter. Let us do the right thing, because Martin Luther said, the time is always right to do the right thing. Sometimes it is better to lose and do the right thing than to win and do the wrong thing. Vote no, please.
Carol.
Wow, it's getting hotter in here. Okay, my last remarks is that all adolescents should be given their information based on their sexual reproductive health and rights. They should be given equal information so that they get to decide on what to do and what not to do. When we are given information, we should also look at the abstinence part, where you get to educate them the importance for those that are not engaging into sex. And for those that are engaging into sex, we get to have the preventive measures that they should follow and look upon so that they don't find themselves in risk behaviors. Also, with the healthy care workers, let's not overlook when an adolescent comes to a clinic when they want to access the service. It's for a reason and for their benefits, for them to have a healthy life. And also, with rural areas, most of us, I'm sure we have a lot of organizations that are here. We are mostly based on urban instead of rural. Let's go out there in rural areas. We get to educate the adolescents so that they have the equal information, just like the urban adolescents that are having the equal information on health and reproductive health. So the other thing is adolescents who lack independent consent on reproductive health may experience negative outcome in multiple domains of their lives. This can include physical, mental, and legal well-being. So I urge you to say yes, because we're giving them information and then they can make their own informed decision. As you give the information, they will apply to what you give them and what you discuss with them. I will say nothing for us without us. We need the information.
And Fanuel, please.
To go back to my earlier statements, I always stand by to raise a child, you need a village. Because as she said, part of me did decide how I wanted other people's lives to be, but then without that village, I wouldn't have grown to where I am right now today. What I'm trying to say is, let's not allow every adolescent to get information, because if we're giving the early adolescents certain information, we're basically telling them, have sex, I can give you condoms. Or you don't want to get pregnant, I'll give you contraceptives. You're afraid of HIV, I'll give you PrEP. That we are not refusing. We do want everyone to have a happy and healthy life. But at the end of the day, we want people to be safe, healthy, and reach maturity so that they can get in to do whatever they want. Not having, like Dr. Magongo said here, the iPhone 15 is coming out. How many girls are going to be out in the streets doing everything that they can just to get their hands on a gadget that's worth a car? That's where I just want to get it from. What I'm trying to say is, teenagers, basically, if I were to define them, is people who are too young to do what they want to do, but too old to do half of all they want to do. I don't want them to get in a place where they shouldn't go in first. At least get the information that you need, slow by slow. Don't force it on yourself. Just go straight to the point and say, okay, you know what, I don't care. I'll just Google it. Oh, this is how I can stop myself from this. Or just go get some information from people. This is how I can do this. But at the end of the day, when everything hurts, everything is down bad, who's the first person you're going to call? Are you going to go back to the doctor? Oh, I'm pregnant. But you still have to go back home. If your parents don't know what's going on with you, what consent are you just giving around so that your parents don't care, the people who brought you here in your life? So my rebuttal is, I just don't want every adolescent to have certain information that they shouldn't have at that age, because they don't necessarily need it, but at least when we look at it, they shouldn't go beyond it, so that they shouldn't experiment to go beyond what they should. Because if a 10-year-old sleeps with a man who's 30 years old, I believe you're giving predators at least some sort of advice or some sort of things to say, oh, you know what, she's 10, but she consent to this, it's okay. So that's what I'm trying to get from. Thank you.
Now let's go with another round of applause for our fantastic debaters. And now the time is to vote again. So we are going back to the screen with the voting instructions. I will read it aloud for those who cannot see it. It's going to be the same, menti.com, menti.com, and the code is 83938832, menti.com, and the code is 83938832. Please vote. We will do the same. We'll try to wait for 100 votes to cross the line so we show you the results. All right, we're getting there. Thank you for voting. Please keep voting. Okay, menti.com, 83938832. Slow, yeah. We're giving it extra time. If you notice, we're running 15 minutes behind this, 10 minutes behind the schedule. So please, I see some of you raise the phones to catch the connection. I don't know. Let's give it another 2 minutes or so. Is it our network that's down? It's just very slow, okay. Well, there are too many of us to count hands, so I think we'll have to stick to electronic format. What we could do is, if it continues to be an issue, we could just ask people to raise hands who changed their opinion, if you think. Oh, it's 100 now? Okay, we hit the 100 point. All right, let's look at the results. Wole, Dr. Eleanor, Carol, Fanuel, are you ready? So, according to the rule of the debate, those debaters who changed the most opinions from the baseline vote have won the debate. So I have to congratulate Eleanor and Fanuel for winning the debate. I do think, in all honesty, that some personal touches on Wole playing billiard, pool, have played a role in how people voted. But nevertheless, what I see in this debate and in this, it's an ongoing need to continue that work and conversation. I think we all agree, we heard valuable points from both ends. We cannot disregard the no points and just push the forward motion yes. We just cannot. They are valuable points. We need to continue working and developing it. Listening to the debate today, I ask myself, did we ask the question right way? Should we have asked, is that the right time to do it? Or should we have asked how to do it right? So there are different ways around it. I'm grateful for that conversation, and for those of you who are disappointed at the room, I don't see it as a disappointment. I come from settings of overwhelming capacity of consent that is independent, and I can tell you there are not challenges there as well. And I think this to me serves as an ongoing continued discussion and elaboration and learning experience. And I urge those of you who have not agreed to continue this dialogue, because that's how we will reach the consensus. We will need to reach the consensus at some point and recognize that the need is out there and how to best to meet it. And I think both debaters, despite the disagreement, have convinced us of the need is out there. So, let me thank all, Wole, Eleanor, Carol, and Fanuel. I will ask you to stay while I do closing remarks for the session. We are adjourning the first day today. There are a couple of housekeeping points. So please, please fill in online survey. It's very important for us to hear from you so we can build our next year program according to your feedback and learn what worked, what didn't work. You will be getting emails today, you will be getting emails tomorrow. Don't disregard them. It takes only a few minutes to go online. Right after that session, we are going to walk all outside. Please follow the guidance for the group photograph right through these doors, for the group photographs with all of us. The biggest fun after virology education meetings is to receive this photograph and spend 10 minutes looking for your own face in the whole group of people. But most importantly, you will not get any drinks or any food if you do not take a picture, just joking, at our marketplace and network reception that will follow right outside in the garden area in front, which is a fantastic opportunity for you to relax after a very long and intense day, network with each other. Another very important thing, that during that networking reception, we are going to see United Movement Toolkit launch, and we saw all how energized and what a wonderful group it is. So make sure you do attend this. So please, after the closing of the first day, which I have a pleasure to do on behalf of the co-chairs, let us proceed to the group picture now, and then move on to the networking event and marketplace. Thank you all.